pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The reason for this meeting is to give you an explanation. We passed week before last on the floor of the House for the first time ever a prescription drug benefit for seniors in Medicare. And to answer your questions, explain a little bit about what the bill was that we passed, and we had bipartisan support for it. I think, addresses a lot of the problems we have here for seniors and also for our health care system here. As you're all aware, we've never had prescription drug coverage under Medicare going back from when it first started in 1965, and if we were to design Medicare today, it certainly would include drug coverage because the way medicine is practiced today is much different than it was then. You're in the hospital, you had more invasive surgeries, and the system at that time covered your drugs if you're in the hospital, but nothing outside. Well, it's changed dramatically today in that the average person in Medicare has two chronic ailments. They're treated on an outpatient basis so that the drugs are not paid for under Medicare. And so we've got to change that and focus as much help as we can on folks who need the help the most. And those are the lower income folks. And also, I know, like my mother is very, very concerned about catastrophic coverage. She and Dad worked for 62 years and tried to save money and set it aside so that they could be secure in their retirement. And the idea of having an illness which would wipe out their security long term is something that we need to address. And that's a very, very important part of this benefit that we passed. The President has been very much involved, and we asked him to make a statement as far as what he sees with the Medicare prescription drug benefit. And I'm not in charge of it. Lois Clark here is, what are you down here, Lois?
I'm here the fourth Tuesday, the fourth Tuesday each month from 2:30 to 3:30 at the library here in Pocahontas.
We have someone in every county every month, so you don't have to drive to Fort Dodge or Spencer or wherever. So. But the President wanted to do a video.
What about Dasha? We won't even bring it to the floor in the Senate.
Thank you very much.
Very good. Just to give you a little update as to what is happening or about the bill itself. As you're well aware, we're really addressing in this bill two different situations. One is the prescription drug coverage for seniors themselves, and the second is the reimbursement issue for us here in Iowa. On the drug coverage part of it, that section of the bill, I think it has some very, very positive things for seniors. And as you know, in Iowa, we have virtually no drug coverage paid for by Medicare available. And like I said earlier, back in '65 when they designed Medicare, they said everything would be in hospital care and they would pay for it. That's the way medicine was practiced. But today, knowing that the average citizen, senior citizen, has two chronic ailments, they on average spend about $2,150 a year on prescription drugs, that is no longer viable. The two chronic ailments, whether you have diabetes or arthritis or high blood pressure, whatever, you're probably on some medication all the time. What we did in this bill was to find a way. We first of all set aside $350 billion to address the problem over the next 10 years. What it does is, first of all, on the first $1,000, Medicare would pay 80% of the cost after a $250 deductible, $33 a month premium. The next $1,000, Medicare would pay 50% of that. So the average person on Medicare today at $2,150 a year of expenditures would save about $940 over the period of a year. And then you would pay then up to a maximum of $3,700, and then there would be no payment beyond that. Medicare would pick up all of the catastrophic costs of prescription drugs. It also focuses primarily on lower income seniors. And if you're at 150% of poverty, which is a little over $13,000 a year of income, the Medicare would pay your premium and your deductible. If you're eligible today for Medicaid, actually Medicaid in Iowa would wrap around this coverage, and you would never pay anything except a co-payment on individual prescriptions. And anytime you know that anytime you give something away free, it's going to be abused, so there's always going to be a small co-payment on individual prescriptions. And also with that coverage tied with Medicaid, as you well know, is 60% state funded, 40% federally funded. It would save the state of Iowa $337 million over the next 10 years. And I think with the budget shortfalls we have in Iowa here, that would be a welcome relief as far as the state budget is concerned. So the poorest low-income people in Medicare today, and if you remember that 70% of those are women, because on average their benefits are about 50% of what men's benefits are. Basically the earnings that men have, women oftentimes traditionally have stayed home, haven't had the outside income. So it focuses 70% of those folks would be women who are helped with this on the low income side. The other part is absolutely critical, I think, for Iowa and our hospitals and our health care providers. As you're all aware, we have the lowest reimbursement in the country as far as our hospitals are concerned. We were facing over 5% cuts for our doctors, 15% cuts for home health care. That has been turned around so that there will not be the cuts for the doctors themselves. In Iowa, actually, they'll get a slight increase. The home health care reimbursement goes from a 15% cut to a 9% increase, because that really is what keeps a lot of people independent living in their homes today, to have someone to be able to come in and give them assistance at home. The hospital formulas themselves are changed so that if, say here in Pocahontas, if you're a critical care access hospital, you would have a full market basket increase. By that it means all of your costs that you have here. You would not have the reimbursement issue would not affect us in our hospitals here. On top of that, you'll see a 5% over the next 3 years increased payment to the hospitals, so that we're catching up finally a little bit with the high reimbursement areas. And the reason that all of the health care providers, the doctors, the nursing homes, the hospital association, the nurses association, the physical therapists, they're all supporting this, is because we finally addressed the reimbursement issue here in Iowa, which is absolutely critical. And I know, like my mother, who lives in the big town of Alexander, 168 people, you know, for her, if she lost the hospital over at Belmont, she would probably have to drive to Mason City. She's 85 years old, and she still drives, but I did not want her having to drive 45 miles to go to see a doctor and get health care. It simply is a matter of not only having quality health care here in Iowa, it is a matter of having health care available to everyone. And we all know our communities trying to grow and attract young people. If you don't have basic health care and good health care, you're not going to attract any